we watch these numbers, and as we have been for the last 2 years through this entire pandemic, and I wonder how useful they are at this point. First of all, you have a lot of people who are testing at home. Second of all, these cases don't seem to be quite as severe as the ones we've seen in the past. And I know the hospitalization numbers are the ones that we really should be focusing on. But again, I wonder there if we should be focusing more on the people who are hospitalized because of COVID, not those who are hospitalized and happen to have it.
Right. Becky, you're pointing out, I think, a change in the trend, obviously, from a year ago where cases mattered and we didn't have hardly any people vaccinated. It's shifted now. To your point, I think we're trying to tease out, but this just indicates how poor some of our databases are, Becky, because states measure things differently. And of course, doctors such as myself might put a certain condition, heart attack, let's say, as you mentioned, the primary condition for admission. But did we discover their COVID incidentally because we're checking everyone, or did COVID actually kind of precipitate some of their underlying conditions? That I don't think we're going to tease out. I think what we do know is that these trends have decoupled. I think that's critical. So you're right. I'm not sure counting cases is relevant honestly, Becky, than to tell people there's so much of this that it's everywhere. Just kind of feeling and acting in your actions day to day, treating it as if it's everywhere, because it truly is. Maybe 1 out of 3 people that are positive as of this week in the DC area. So I think that's critical. But other than that, it's not as useful.
Yeah, those numbers that you just mentioned, 1 out of every 3 people in Washington, D.C. this week. And I think in New York City, too, 1 of every 3 people getting tested is coming back with a positive result. I mean, that's kind of phenomenal. Yeah. I don't think we've seen that at any point during this pandemic, to have 1 out of every 3 people getting a test coming back and getting a positive result.
Yeah, that's right. And the pretest probabilities now, it's almost, Becky, kind of self-evident, right? People who are presenting for tests, the conversation you just had, people are presenting because they're at milestones. They need to start school, or they have symptoms. They came back from a trip. So we're getting people at these really critical high pretest probability time periods. That, of course, makes it a higher chance that their test is positive. But we're also seeing, as you pointed out, the limitation on these tests. I myself am going to try in clinic today a little experiment. I'm going to swab some throats and noses and see, am I getting a critical difference on some of those rapid tests? But it feels like we're kind of flying blind, doesn't it, at times? But we do have tests. They work. We just can't get them, as you pointed out.
Doctor, I don't know if you saw this yesterday. The Florida Surgeon General went public with this idea that he said that Florida plans to, quote unquote, unwind the COVID testing psychology in Florida. Effectively doesn't believe we should be testing, believes that that effectively COVID is so rampant that there's no reason for it, and that it's going to be endemic, and that we should just stop. This caused a fury from a lot of folks in the medical community. But then there is this argument that here we are, and maybe it's just unstoppable.
Yeah, I will say this. Testing is just a mainframe of surveillance. So it's exactly why we shouldn't pay attention to the numbers to the point where, well, today we're at 500,000 cases. That means we're better than we were yesterday if we were at 600,000. That's not the point. But the point of testing is to exactly find out, when you showed maps of where regions are lighting up. We know this is a regional surge. Testing can become critical also because of the very reasons we fell short with Omicron. We need to do more genetic sequencing. How do we do that if we don't have some stable kind of proportional sample of a country to surveil? And now we're at the point where I think saying go away with testing, it honestly, it reminds me of a couple of years ago where we thought we were testing too much at the beginning of the pandemic. And that was absolutely not the case. I think this is just confusing people more than ever. And I think in Florida, especially where we're seeing cases rise 900% over the last 2 weeks, it feels like a very convenient excuse to just ignore basic public health measures.
Shepard Smith here. Thanks for watching CNBC on YouTube.